So my overall impression of the LiBBY study is fantastic. I've always been very close to my parents. We traveled a lot, business trips. If I could go, I would go with them, or vice versa. My dad was just extremely active. As a matter of fact, he was still working, and the only reason why he retired was because of this illness. My dad, his wishes and what he's always wanted to do is to participate in research and to help try to find something for Alzheimer's. The visits were great. Scheduling, it was very easy. The visits were actually at our house. I always was very excited when we had the visits. We would share every little detail.
My name is Leah. I am a clinical trials coordinator at Georgetown University, and I work on the LiBBY Study. There are a lot of things that drive my work on the LiBBY Study. I would say the main one are the people, namely the participants and their caregivers. The study is unique in that we're seeing them very often over a very short span of time. And as a result, we form a very close relationship with them, and that's fairly unique. We also get to, put them in touch with resources they may not have known about, like hospice or at-home doctors or nurses. So we're able to provide them with resources they may not have had otherwise. The drive of the study is really just about giving people compassion and dignity through the end of life.
So for me, the study visits were great. Scheduling, it was very easy in terms of being able to schedule that would be good for everyone. The visits were actually at our house. I was expecting to come to Georgetown, but they said they would come to the house, which was great. For us, it was the scheduling was very easy. And as I said, they really make it so that it fits your schedule.
A typical visit is around 2 hours max, conducting some assessments with the study partner and talking to the participant, sort of getting a feel for how they've been doing since the last time we've come, since the last visit. For time constraints, we really do try to be flexible and work around the study partner's schedule. We understand that typically the participant and the study partner, their day-to-day can vary, and that they can be busy, especially if the study partner is still working full-time. So we try to pick a time or suggest times that would work best for the study partner. Everyone should really pay attention to the study, and it has a lot of importance because in this country, people are living longer, which is great, but it means that the rate of diagnosis for Alzheimer's and dementia is only going to increase. And while there's a focus on prevention studies, I do think that there will be people who reach this stage and more of them. And I think that as a result, we'll need an effective treatment for this.
Really, the bottom line is if it can improve their life and just make them as comfortable as possible, you should definitely look into participating in the study, because for us, it really was great for my dad.